Hey everyone, it's me, Dr. Whimsy, and today we are talking about type 2 diabetes. I've been asked to speak on this subject because type 2 diabetes, unfortunately, is one of the fastest growing chronic diseases in the United States. Type 2 diabetes used to be a condition that we saw in people over the age of 40, but now, unfortunately, we are seeing it in young people as well. In addition to age being a risk factor for type 2 diabetes, obesity is also a risk factor. And so, unfortunately, because of the standard American diet and because of a rise in obesity, we are seeing a rise in diabetes as well. Signs and symptoms of type 2 diabetes include fatigue, chronic pain, slow wound healing, depression, mood changes, thirst and chronic hunger, frequent urination, a belly fat. This patient often has a lot of belly fat, and this patient might be over the age of 40, but not necessarily. Somebody who is eating a standard American diet, soda pop, junk food, corn syrup, sugar, that sort of thing is probably going to be somebody who is at risk for type 2 diabetes. Depending upon the history of the patient, some cases of type 2 diabetes can be reversed. They certainly have to be monitored. Your doctor has to monitor you. I want to talk today, though, a little bit about what I do and what other naturopathic doctors do so that you can know a little bit about us. And if you'd like to see a doctor in your area, we will give you a link to find a naturopathic doctor in your area. When a patient comes into my office and I suspect that they have type 2 diabetes, there's a couple of tests that I like to do. In addition to a thorough intake, I'm going to do a physical exam. I want to weigh the patient, take their blood pressure, because hypertension is often one of the things we see in patients with type 2 diabetes. I'm also going to take a measurement of their waist and their hip, because we see that the waist to hip ratio is quite high in these patients. I want to get their BMI. I want to find out how much fat the patient has and what their BMI is. And I also want to do something called a BMR. I want to find out how many calories they consume daily simply to maintain their basic metabolic needs, their BMR. And from there, I'm going to build a diet plan for them. There's been some discussion about what the best diet is for somebody who has type 2 diabetes. Should it be plant-based? Should it be paleo? My experience is that it depends on the patient. I'm not a fan of paleo. I think it's really unhealthy to be pouring massive amounts of oil into your food. And the lab work coming back on people who are on a paleo diet, I often see elevated triglycerides and high cholesterol. And that is not what I need to be seeing in type 2 diabetics. In pre-diabetics who have a condition known as metabolic syndrome, we will often see hypertension, elevated triglycerides, and we'll often see a blood glucose above 100, under 125, which shows that they are probably on their way to diabetes. In terms of the labs we usually test, you will check a CBC, CMP, that's the basic chem panel, and blood panel. And I also recommend doing a fasting glucose, a hemoglobin A1C, to monitor what they're doing in terms of how their blood sugar has been monitored over the last few months. That's why we do a hemoglobin A1C. It's a marker to determine how well they've been monitoring their blood glucose over a certain period of time, 3 to 4 months approximately. I also check thyroid because I want to know if the underlying cause is hypothyroidism, because in a hypothyroid patient, you're going to have obesity, trouble losing weight, and then that's going to put you at risk for chronic diseases like diabetes if that is not dealt with. The diet I give is a high fiber diet because fiber slows down gastric emptying. It slows down how quickly glucose will enter the bloodstream. So whether or not a person eats meat or not, the main, or they're vegan, doesn't matter. What does matter is that they keep the fiber levels high. Usually between 30 and 50 grams of fiber a day is what I recommend. When I build a protocol for a patient, it's usually 3 meals and 2 snacks, and it's usually low glycemic foods, low glycemic load. In terms of the type of foods they eat, they're whole foods, excuse me, nutrient dense, nutrient dense. And the average patient will be about 70% of the plate will be plant-based and 30% will be animal products. Some patients will go lower than that, where it's just 20% animal products. If the patient has elevated cholesterol, then the only animal products I recommend are egg whites and fish like salmon, cod, sardines. I pull dairy usually. Some doctors think dairy is fine. I think it's give or take. If you do a non-fat yogurt where the lactose has been consumed by the probiotic, it's probably going to have a lower glycemic index than a non-fat milk. So you might be able to get away with that. You might be able to get away with non-fat cottage cheese as well. But I'm a little wary with dairy because for some patients it can cause inflammation, and we're trying to get inflammation down in this patient. So yeah, depending upon what kind of history, what kind of patient we're looking at, everybody's diet is going to be different. Some people can go 100% plant-based. I find the majority of people do well with a little bit of animal product. As I said before, most people do just fine if the animal products are egg whites and fish, if those are added. Just because you want to have protein with every meal and you want to get the glycemic load down. Low glycemic foods that are good for diabetics: onions, garlic, green leafy vegetables, definitely a great idea. Should you do beans or should you not do beans? I think some beans are fine. Usually about 10%, 10 to 15% of the plate is fine. The ones that are higher protein I think are fine, like tempeh, tofu. The ones that have the higher glycemic index, if you load up on them, some people can have an adverse reaction. Again, though, the underlying issue for me is to make sure that the foods are whole foods and that they're fiber-based. And I don't encourage high oil. I just don't. I think that it's a bad idea to do high protein and high oil. High protein is hard on the kidneys, which is definitely not the direction you want to be going with a diabetic. And lots of oil will elevate triglycerides and cholesterol, which is also a direction you don't want to be going with this patient. So I think it's a faulty argument. Instead, it would be good fats like omega-3s. If you want to go plant-based, that's fine. Do the flax. And again, I can't reiterate it enough. Fiber, fiber, fiber foods. Raw foods have a slower transit time than, they have a lower glycemic index than cooked foods, particularly if you're talking about the root vegetables. In plain words, if you chop up a carrot and you eat it, it's going to have a lower glycemic load, lower glycemic index than if you were to steam it and cook it really well. It would be easier to digest, and the glucose will get into the bloodstream more quickly. So that's something to take into consideration. I don't encourage juicing. I know there was a huge juice craze. I strongly discourage that with pre-diabetic and diabetic patients because, again, that causes glucose to enter the bloodstream really, really quickly, and the fiber has been thrown out. So, it's fiber that is the magical cure. And where does fiber come from? It comes from plants. It comes from whole foods. So the more plants, the more whole foods, the better. I do allow nuts and seeds. I think a handful of nuts and seeds a day is just fine. They have a low glycemic index. They fill you up. They taste great. And walnuts, for example, have the good fats in them. Okay. That just about wraps it up. I just wanted to do a brief introduction. There's so much I can talk about in terms of how type 2 diabetes is treated by naturopathic doctors, but this is what I do. I do a thorough intake, I do a thorough physical exam, and I build a protocol of 3 meals a day, 2 snacks. I have them check their blood sugar 3 times a day, morning, after lunch, and evening. And I have a goal of losing weight of about 2 to 5 pounds a week, depending upon the weight of the patient. Okay, that about wraps it up. I hope I answered all your questions, and if you'd like to find out more about naturopathic medicine, you could go to the American Association of Naturopathic Physicians to find a doctor in your area. And if you'd like to telemedicine work with me for general wellness appointments, you can do so by following the link below. I want to thank you for watching this channel, and I'd love to answer any questions you have, so be sure to share, like, subscribe, and thanks for listening. Bye-bye.